Okay, perfect. So my name is Abdulhadi Jfri, and I'm a last year dermatology resident here at McGill in Montreal. And today, guys, I'm going to talk to you about the dermatology residency in Canada. And these are the objectives of the talk. So we'll start with an overview: is what is dermatology specialty in general, and then what are the training centers that are available here in Canada? How is the workload of dermatology during clinics, consultations, and finally, how to apply to dermatology residency. So we'll start with an overview. So we know that dermatology is also known as dermatology and venereology, where dermatologists not only deal with the skin, but also deal with the sexual transmitted diseases. And skin doesn't mean only skin, it means hair and also nails. And now we have subspecialty in dermatology where some people are just only specialized in nail surgery or in hair disorders and only see hair diseases. So it's the largest organ of the body. And there is also misunderstanding of dermatology, especially in our community, that they think, oh, dermatology, like for example, my mother, when I go to work, she's, couldn't you just bring some creams for my skin with collagen and all of that? Their impression about dermatology is purely cosmetics, which is honestly not reality because some programs in, especially in Canada, they're 100% medical and you barely get any, if you actually get any cosmetic training during the residency. But other programs, especially in the States, they have a lot of cosmetic training implemented in their program. So as we mentioned, cosmetic dermatology, just a branch, and you could do it as a subspecialty later on as a fellowship. So what are the main differences between dermatology residency in Canada and in other parts of the world? So we know that in Canada it's 5 years, so it's longer than US and Saudi Arabia. The first year here in Canada are off service, which means that during the first 2 years, you would do mostly medicine, but you could do other um, fields that are related to dermatology, such as, for example, ENT or ophthalmology or plastic surgery, 1 month each before getting into derm. So all the residency programs in Canada, and this is a major difference between residency in Canada and other parts of the world, that most of the all of the residency programs in Canada are affiliated with universities, and all of them fall under the umbrella of the Royal College. Why is that important? Because if you have one institution that are looking at all these programs and evaluating regularly these programs, you will get an equivalent, at least equivalent level of excellence and training, and the product of these programs will be somehow same. Um, but for example, in the US, there are certain programs that are affiliated with universities, and some are center based or hospital based, and they have their own structure of the program where they put, for example, 3 months of doing surgical dermatology and 3 months of doing cosmetic dermatology. This is not the case in Canada. In Canada, me, for example, and my colleagues in Calgary, Vancouver's, other parts of the country, they do the same exact amount of rotations. And during our last year, when we study together, we feel that we have the same level of training. I think in Saudi Arabia as well, there are certain differences as well in the structures of the programs, but this is the major advantage that I find here in Canada. So why would I think about doing my residency program in Canada? So I think, especially dermatology, we're a visual field, and honestly, the colors and the reflection make a huge difference. So in Canada, we get the opportunity because it's a very multicultural country. You get the opportunity to see people from all over the world. I know that Saudi Arabia now is opening their doors internationally, and there is also a chance in Saudi Arabia where you can see patients of different skin colors. But for me, for example, I work at the National Guard Hospital, and the community there is very narrowed to military communities. So I don't get the chance to see people of all different colors, and sometimes everything's in the book, and I may not understand. But now with this, like international experience where I had the chance to see different skin colors, I feel more comfortable dealing with these different types of skins. So, as we know as well, there are certain diseases that are very common in white and Caucasian ethnicity, such as basal cell carcinoma or even squamous cell carcinoma, but these are very rare in our community in Saudi Arabia. But we see them like daily here. Also, the skin presentation is different, completely different when you see a patient of, for example, Hispanic origin or a patient of African origin compared to a white origin or um, a Caucasian origin as well. So I feel that this is an advantage. It will give you an opportunity to be comfortable and confident when dealing with all these different skin colors. So this is a list of the available fellowships that I find here in Canada and maybe in the States. After doing your dermatology residency, you could do something in dermatopathology where you only read slides, and you could actually do clinics as well at the same time with it. Or you want to do pediatric dermatology, surgical dermatology. Most it's not well needed in Saudi Arabia, but in North America, it's really highly needed. Cutaneous.
دكتور، أسفة على المقاطعة، بس إذا ممكن بس ترفع صوتك أو تقرب من المايك إذا ممكن.
Okay.
شكرا، يعطيك العافية.
Okay, perfect. So guys, let me know. I have another AirPods that I can use if you guys don't feel me, don't hear me clearly. So we mentioned the light and the laser cosmetic dermatology, and then also you can do contact dermatology and patch testing. There is a subspecialty in Boston for dermatology with rheumatology and also for advanced complex dermatology, where you see mostly inpatient consults, complicated cases of genoderm, and also immune bullous diseases. And finally, you could also do research in dermatology. So what are the available training center in Canada? So this is a disadvantage of Canada where there is a limited number of training centers. So you could have it in Vancouver, Calgary, Alberta. Calgary and Alberta is honestly the same program because joining them, the residents, they go together. And then you have Toronto, Ottawa, and Montreal, McGill. But then you have two French schools here in Montreal, Université de Montréal and Université de Laval. And then you have Dalhousie University. So when you think about the map of Canada, you will see that also you have to think about the weather, and also you have to think about the population. If you want to see a wide range of population, it's honestly a great opportunity here in Quebec and Montreal. But one of the disadvantages is the weather. When it's snowing and it's cold for 6 to 7 months a year, it may not be very pleasant. So how is the workload? So this is from the Royal College of Canada on how the residency Canadian program is structured. So as we mentioned earlier, that the first 2 years are mostly medicine and off-service rotations, but related to dermatology somehow. And after that, the remaining 3 years are purely dermatology. So the load varies based on the rotation that you're doing. And in terms of calls, we have night shifts where we start after 5 p.m. until the next morning, 8 a.m. And these ranges from 6 to 8 weeks per year per residency. And then sometimes, honestly, we don't get any consults, and sometimes we get around like 3 consults or 5 consults. Some of them are manageable over the phone, but sometimes you have to go, especially if you have a case of drug eruption or a case where you have to rule out like Steven Johnson syndrome, which is a dermatology emergency. And then every month you have 1 to 2 weeks where you're the day call person. And that starts from 8 a.m. until 5 p.m. before the night person covers. And this is a bit busier than the night shifts, where you will get calls from all the departments in the hospital and emergency, and you have to see cases. So if you have a clinic and you have consults, you can do the clinic, and then in the afternoon, if you don't have clinic, you can do the consults. And sometimes you have to excuse yourself from the clinics for an hour or two to do the consults. Now we're coming to the most important part, I believe, in this talk, which is what would increase my chance to get accepted. And this is, I want to start with this before starting on how to apply, because I get this question often. And my advice to everyone is uh, don't have one thing that is perfect, but have something good about everything. Like your CV should be good. You should have a very interesting personal statement. And by that, I mean, I see some medical students, honestly, they show me their personal statements, and I could change the name of Abdullah and put the name of Abdulhadi, and it will still work, honestly. So your personal statement needs to be personal. It needs to fit only you. It doesn't. It cannot fit someone else, and that's very important. So make it very personal. Research and scholar activity, publications. When I applied as a medical student, I had 7 case reports published, uh, 6 case reports, and 1 cross-sectional study. So having case reports or any kind of publication is very important, especially in North America now, because a lot of staff in the residency program, they're doing research. And if you're a research oriented, you will help them with their projects during your training. Try to do an elective, not necessarily in Canada, but you can try to find an elective in US, and then that also could increase your opportunity. Try to get the recommendation letters from North American trained dermatologists. French language is very important in Quebec, especially at the University of McGill, because you will see a lot of only French-speaking patients. But it's mandatory to get into Montreal and Laval. I remember I did the TFI, which is Test de Française International, just to get into Laval and to get a chance to be interviewed at Laval and Montreal University. English proficiency exam. And this is very important. Some students, they tell me, oh, the university doesn't ask for TOEFL or IELTS. You could write in your CV that you're proficient and excellent in English language, but you need to have a proof on that. And having a proof would be sufficient by applying your score of, for example, the TOEFL and IELTS. These are two like recognizable English proficiency tests. So I would still recommend doing it even if it is not required. And if they know you, that's very important. If you come to them and do a rotation with them, I did a rotation here at McGill before I applied to them when I was a med student. So I feel that helped. I didn't have the great knowledge, but I was punctual, coming early in the morning, respectful. Because think about it, you have 5 years to learn dermatology. They don't want someone who already know a lot of knowledge, but they want someone who is, easy to work with for 5 years. Adaptation to culture, and I believe adaptation is not to copy paste them, but adaptation to be, to get yourself in smoothly. So if we have 2 applicants, applicant A has a very high scores in terms of GPA and also the Canadian exam, but doesn't have any research, and he did only an elective back in Saudi Arabia, and his recommendations letter are from Saudi Arabian dermatologists who trained in Saudi Arabia. But applicant B has an average GPA and average the Canadian MCC exam, but has some publications and also did some rotation in, not necessarily in Canada, but in US, and also has a recommendation from people who trained in US or Canada. So personally, applicant A could get in, but in my personal opinion on this, I would think applicant B has a higher chance to get in. How would I apply to Canada? So the application process is very easy. It's through the Saudi Arabian Cultural Bureau website. And what do I need? You need a sponsor letter, and this is a financial guarantee from the place that you will go back and work at. And then you need your CV to be updated, 3 letters of recommendations. And this is a bit different than here in Canada. Here in Canada, sometimes they mail the letter or they send it through a secure system, and it's very confidential. But in Saudi Arabia, unfortunately, you have to open the letter and you have to scan it to submit it. I don't know if has changed, but this was for me an issue because I believe the enveloped and sealed letters has a higher, I think it's more powerful, honestly. And then you should have like a TOEFL, IELTS, and French exam if you're applying to a French university, statement letter or the letter of interest that we talked about, a certificate of your most recent workshop and conferences. So what will happen after you complete your application online, the Saudi Cultural Bureau in Canada will send these applications to the postgraduate office in the universities in Canada. And as I mentioned earlier, all these programs are affiliated with the university. So the university will check with the dermatology department if they have availability, and then they will look at the applicants, and then they will select out of 30 applied applicants, let's say 10 or 5 to come for the interview. And then they will send an interview invitation. And after that, after your invitation and you do the interview, either last year, I believe they did it online, like virtual, but before that, it's usually in person. I believe the virtual is easier. And then basically, they will tell you the result in 1 to 2 weeks. Some programs here in Canada, they ask the applicants to rotate with them for 1 week to see how they work and how they function in the hospital. This is not in dermatology, but may happen. So just be ready for that if it happens. And then I think we have an advantage this year and the coming years that Oman, for example, because there is something that Saudis they don't understand. They think they compete with the Canadian, but the Canadian, their application timeline is completely different. So this is for outfunded residents, and this is only for people from the Gulf area. So you will see with you in the interview people from Kuwait, Emirates, Qatar, and Oman. And I believe Oman stopped sending residents, but to very, very highly needed specialties. So that increases the Saudi opportunities from my um, point of view. So this is how the website looks like, and this is how you apply through the system. The salary, you will get a salary from the Saudi Cultural Board, the embassy here, which is around 2,000. And you will get the 1,500 from the university, and then your back home salary, which is half your original salary without any additional fees. So that would range from 3,500 to 6,000 based on your sponsored hospital. I'm from the King Saud bin Abdulaziz University for Health Sciences, and I get 4,000 Saudi riyals in my account like monthly. But my colleagues from King Faisal Specialist, they get, I think, above 6,000. So it depends on where your sponsor is. I did other talks, and they're available online. That could help you if you want to do a case report or see how writing a case report could be something easier than you imagine. Because for me, the first one was really a nightmare, but after that, it gets easier with time. And then also, I did a talk on how to prepare for the TOEFL and IELTS, and I believe they're important to do. So take a look at these talks. Before I proceed and read your questions, I just want to tell you that these are the common questions that I get most of the time is what is the acceptance rate among Saudi's applicant and how many seats? So it varies from one university to another. McGill, for example, takes around 2 applicants, and other universities like Dalhousie, Calgary. There is one Saudi in Alberta. Vancouver takes as well, but not every year. Toronto, usually they don't take unless you do 1 to 2 years of internal medicine in a North American university. How do I increase my chance of getting accepted? I mean, we went over that and I told you you should have something about everything, but and early preparation is the key from my opinion. What are the requirements to look for the candidates in CV wise? So your CV has to be structured. I believe I did a talk before on how to structure a CV. If you guys want, you can email me. I can send you my CV. I honestly don't mind. And you can take a look at it and see how it's structured. And then you could do the same. What are the different subspecialties? So we went over the fellowship opportunities. What the daily aspect of this dermatology aspect. So we spoke about that, the workload, the on-calls and hours per week. Things can make me stand out from the rest of the candidates that are applying. Again, I think it depends on the year. Some year I was in the interview committee for 2 years because I was assistant chief and then chief resident. And honestly, some years we had so many good candidates. Like if I'm with them, I wouldn't get into dermatology. They're really strong. I mean, in terms of publications, they did rotations, they did volunteers. They actually created their own projects in dermatology, applications, websites, campaign. They show really interest in the field. And other than things, one of the advices I would give to Saudi applicants is usually we do a lot of volunteers and a lot of conferences and workshops, dermatology, ophthalmology, plastic surgery, which what happened to me when I was a medical student, but I deleted them. I made my CV purely dermatology, and I would really advise you to do the same. Take out the ophthalmology conferences, take out the diabetes conference, the multiple sclerosis. You don't need them. You want your CV just to say dermatology and nothing else, and if so that you don't distract the committee. Seats available, positions in this specialty. Is there a saturation? I think there is still a big need for dermatology, especially in Saudi Arabia. What was your process in choosing the residency you wanted? So this question when I get is how would I decide to choose my specialty? I always tell whoever is asking me is try to imagine yourself going to the same work every day for the rest of your life. Would you like doing that? And go to dermatology, try it for a few days, and then basically think about it. Say, okay, so I tried it for this week. He goes in the morning, he does that, he sees patients, and in the afternoon, he finishes whatever he does, he sees consults. Would that be my life? Would I be happy if that would be my life? And think about it from this respect. I believe from this aspect, and I think if you think about it from this aspect, if you're like imagining yourself doing this for the rest of your life, that would make a change on your decision, which was a super problem for you, and what is the thing you wish you knew before choosing? I think I was lucky before getting into dermatology that I had people who told me, "Oh, dermatology in North America, forget about it. See, completely, it's impossible," and who made me actually prepare my application to apply for the Saudi board, which I didn't apply for. And after that, some people told me, oh no, you could easily get Canada. And those who actually told me this, I still remember their names. And I'm very thankful for them because they were really supportive. And I would do the same for you guys. Is early preparation is the key, and be patient. If you want to get into dermatology, you may have to wait 1 or 2 years before getting into dermatology, which what happened with me when I applied to Canada. They didn't take any applicant the year I applied, and then I reapplied the year after. And I think it's an advantage because I put more in my CV. And doing residency abroad is not only advantageous in terms of the teaching and the learning opportunity, but also it's a cultural experience, and you learn a lot from traveling and meeting people from all over the world. And do not listen to anyone is telling me that dermatology is impossible. It's not, honestly. And if you want to guys contact me, I'm pretty active on Twitter. I haven't been the last year because I was preparing for my board exam, which I did last week. And usually anyone emails me, I get back to them in 1 to 2 days max. And thank you so much for having me.
يعطيك ألف عافية دكتور. It was a really great presentation. You really covered everything in great detail. شكرا مرة. Attendees, participants, اللي حاب يسأل سؤال, we have the Q&A feature and we have the chat, and I'll be happy to read these questions to الدكتور.
I think someone is asking what is a personal statement. So we spoke about the personal statement. So the personal statement is a letter of interest, is a letter that you have to write. It's maximum 1 page. And in this page, you would tell why did you like dermatology and why would they take you. So in this letter, for example, mine, I started my letter saying, as a person who paint and who loves art and going to museum, I think this is something attracted me to dermatology. And because I'm a visual person. And then I spoke a little bit about my experience as a medical student when I saw my first consult and how the staff complimented me on my visual differential diagnosis. And I told them what are the advantages in their program, and then basically what I have that qualify me to be a good fit for their program. Unfortunately, for the Saudi application, that we send one statement letter that will go to all universities, which is not the case in Canada. In Canada, you have to send a specific personal letter to every university, specific for that university. What are your publications? Should all publications be dermatology related? So this is also, I should add it to the common questions that I get. So if you have dermatology related, that would be better. But if you don't, I would say put it, because I had someone who told me I have 3 publications, but they're in plastic surgery. But I changed my mind and I want to apply to dermatology. I'm afraid if they see that my publications are in plastic surgery, they wouldn't take me. I told him, at least having publication shows that you have an experience in research and you know how to conduct a research. And of course, if you get into dermatology, you will be doing dermatology research. And I would put it honestly, because that will show that you have some research skills. If I have Saudi board dermatology certificate, what are my chances to find fellowship? Is there any even attachment? So fellowship, again, in terms of the fellowship, you have to check with the Saudi Cultural Bureau website. I posted the fellowships availability in the in one of the slides. For the one in the States, there have been a lot of changes in the recent 2 years, and they actually made it more strict where you only have to get it from ECFMG accredited program, and you need to have, your USMLE step 3, and you need to have a US license. So for years it got very complicated. In Canada, I think it's still doable, and I've seen a couple of Saudi applicants who actually came to Montreal and Toronto to start their fellowship next month. So it's still doable. You just email the Saudi Cultural Bureau and ask them for what is the most up-to-date list that they have. In the recent years, has any Saudi been? Yeah, there are Saudis accepted. I believe there are two who got accepted, and they will start in 2 weeks, dermatology here in Montreal. And I think there is one in Dalhousie and one in Alberta as well. Yeah, there are a lot of Saudis who are getting accepted. I mean, I know the guys are a bit worried about the Saudi Canadian governmental conflicts that happened. But honestly, I see that the Saudi embassy here is very supportive, and they didn't make us feel that there is anything that could impact our career. Would I have better chances if in acceptance if I applied in Quebec? So you do not choose where to apply for, you just do the application through the system, the Saudi Cultural Bureau system, and then the system will send your application to all the universities that offer dermatology residency. So don't worry about that. For the University of Quebec, if you mean University of Montreal, University of Laval, they're French speaking, and they have an exam. It's called TFI, which is Test French International Exam. I did that in Riyadh, and I had to redo it 2 times because I didn't get the score that they wanted. And then I did the interview. But honestly, I think it's really difficult to study purely in French. However, I know some Saudis who actually did it in neurosurgery and other specialties. Do you have to take the MCAT or only the MCCE? So this is an update, and I think maybe in my slide I put the MCCEE, but now they ask for the MCCQE Part 1, which is similar to the one that the Canadian do, which I believe honestly better for you guys, because if you think future-wise, you could apply for the license with that exam. So I think the exam now is you do similar to the Canadian, and the CCEE, I don't think it's are required anymore.
دكتور في كم سؤال بالQ&A if you don't mind me asking them.
Perfect. Because I'm clicking on the Q&A and it doesn't show.
إيه ما يطلع, it's some weird setting. One of the questions is the exams in Canada similar to the SMLE عندنا?
So I think honestly it's much easier. So the exam is a question, multiple choice based question, and at the end of the exam, for the part 1, there is a part where they give you a scenario of a case, and then basically you have to select from a lot of options what things you would order for this patient, what is your top 1 differential diagnosis, and sometimes you just have to type what is your diagnosis. But the cases are super clear, and I do have really great material for the exams because I honestly did it during my last year of residency. Like I did it in last November. And the reason I did it because for when I applied, I did the MCCEE, and I wanted to get the license in Canada. So I needed to do the MCCQE1, which you guys have to do now to apply for residency. And I prepared for it for 1 week and I still passed. So it's not hard, honestly. It's so easy. The cases are super clear. The only thing, minor difference, that I noticed that may require you to specially prepare for it, that there is one document on the ethics in Canada. Because, for example, abortion is different from one state to another. And then what to deal with patients who want, terminal patients and, like ethical questions. That needs preparation, and there is one file for that. It's in Toronto North. It's called Ethics. I think that's the only one that you're really required to specifically study. But if you want to study the same material that you study for USMLE or SMLE, you could do that. But do the ethics for sure.
برضو they're asking how can they apply for electives? Are there any fees for electives?
So the fees are really nothing. I did my elective in Harvard, and in Harvard I paid 4,000 US dollars for my elective. So that was extremely expensive. So it depends on where you do it. In Montreal, when I did my elective, I paid 370 something dollars. So the fees are nothing, honestly. Like it doesn't reach 1,000 Saudi riyal. And I believe as well you pay a little bit of 100 here and there, but it's doable. You just have to email them. Just be careful because now a lot of programs stop having observership. So observership when you finish your internship year. So your electives has to be during the internship year and you really need to apply in advance. Like I did mine in June. I think I applied in January. So really apply early so that you plan everything early on and email all the if you want to email you could email the postgraduate office in the university specifically directly or email the program director or the secretary, but you don't have to go through the Saudi Cultural Bureau and they do not have to know about the elective thing. I did not interact with them at all when I applied for my electives.
They're also asking if a Saudi applicant or Arab applicant would have better chances in acceptance if they applied to Quebec.
Not specifically, honestly. Like here they have a lot of Saudi applicants, and they really showed a lot of level of excellence. So our reputation here is amazing. However, when you get into the interview, as I mentioned earlier, it's only for outfunded from the Gulf area. So people from Emirates, Kuwait, Qatar, Oman will be with you on the interview. Um, and as I mentioned earlier, I know Oman stopped sending residents and they send for just specific highly needed specialties like genetic in whatever, but they don't send for dermatology anymore for 5, 6 years now. So the applicants are mostly Kuwait and Saudi Arabian. And rarely you get one or two from Qatar or Emirates. And then they all compete for 2 seats. So your chance is really higher. And I tell some people sometimes your chance of getting into dermatology in Canada, it's even higher than your chance in getting into dermatology in Saudi Arabia. It's but people have this impression that it's extremely difficult and it's impossible. Well, in fact, it's not. You just have to be well prepared for it. So you feel a little bit comfortable. I remember when I came to my interview, I was very worried. I had seven publications, and I still had two like electives, one in Canada, one in the state, and they had a great recommendations. All were from American and Canadian staff, and people send letters, mail, and I still was so worried. But then after the interview, I knew that I was easily ranked one because the applicants with me may not have the same level of like publications, personal statements, and rotations, and even recommendations.
On the topic of publications, they're asking if, in your opinion, there should be a minimal number of research publications to be considered as a candidate, and also if you have to be the first author in all of the publications.
Okay, this is very important because in Saudi Arabia, we have the impression that a consultant wants to be the first author. In North America, the culture is completely different. The medical student is the first author, and the last author is the staff who supervise the work. And this is completely different. And I believe, I hope this changed now in Saudi Arabia because for me is when I'm going to be a staff in Saudi Arabia, I wanted my medical student to be the first author to get a chance to get into dermatology. Being a first author is important for medical student to get into dermatology because it shows that you did most of the work. Is there a certain number? There is no certain number. The more, the better, honestly. It just shows that. And even if you don't have a case report that is published, you could just present it as a conference or as a poster or, you know, worst case scenario, you just mentioned that you presented it as a research day in a hospital or something.
Okay, I think this is the last question. It's based on
Okay.
GPA and scores. Basically, there was one question asking, is there average GPA usually standing in the way of getting accepted? And also, if there is a score limit to get into dermatology, I'm assuming that's in the licensing exams.
Yeah, so basically for the score and the GPA, I had a very high GPA, but I didn't have a high score. I'm telling you the truth. For the Canadian, my score wasn't high, and I still get into dermatology. So that's proof to you that it's not necessary because again, back in the days, number one is the GPA. It's Saudi GPA, so their interpretation of our GPA is different. For them, it's the most important thing is to be eligible to apply and enroll in the program. The other thing that I will tell you, and you're 100% going to judge that the marks are not important, is the applicants here in Canada, after the fourth year of their medical school, they do their exams. But guess what? They apply to the specialty, they do the interview, and they get into the specialty before the mark of the exam is out, which tells you that for them, the mark doesn't mean anything. Because if I'm applying and I'm getting into dermatology and my SMLE mark is not out yet, what does that mean? It means that the mark of SMLE is not important for application. So think about it the same way here. There are applicants applying to the residency without having their mark out. And this, as far as I know, the last year was the thing. I don't know if this has changed this year, but it's always the same.
يعطيك ألف عافية دكتور عبد الهادي صدق شرفتنا و you really answered a lot of our questions and cleared up so many things. Thank you for taking your time to give this presentation و also answer our questions. يعطيك ألف
Thank
عافية.
you again for the opportunity. And guys, I left you my email or Twitter, and you can text me, email me anytime. And honestly, if you have your CV you want me to look at or personal statement, sometimes some people they do their first case report. They're not sure if it is well written, well structured. They're from the technical point. I can take a look at it. I finished my exam and I have some free time now, and I will be happy to help you and assist you. And all the best. Honestly, I wish you all guys get accepted.
Thank you دكتور.